Hi, welcome to Facebook Live. And we have today, I'm Dr. Annette Mercatante from the St. Clair County Health Department. And we have with us our special guest, Mr. Watkins. You want to introduce yourself?
Hello there. My name is Kevin Watkins, and I'm a Wells Township resident, and I am the president of the Port Huron branch NAACP. So I'm happy to be here
Good.
with you. I'm also a professor at the St. Clair County Community College Nursing School.
Great. And Mr. Watkins, it's Kevin Watkins, by the way, not Devin Watkins.
Yes.
There you go. He's going to talk with us a little bit more about some of the more vulnerable populations and how we can improve vaccination rates and uptake in those communities. So let's get started with our data, get to your questions, and then we'll try and get to all your concerns. So today we have close to 9,000 total cases, 8,805, over 500 total hospitalized, with unfortunately those 249 deaths. We added a few deaths this week. So those deaths unfortunately keep coming in. We are now in the last 7 days, our average is 158 new cases, as well as about 20 to 22 cases average per day. If you'll notice that our percent positivity has creeped up a little bit to the 4.5% mark, which is rather concerning. Let's look at the next graph so I can share with you guys some of our concerns, if you will. We have this very nice reduction in cases with a little uptake around New Year's, and then it came down again really nice. And here we are at the end of this graph, and you can see we have plateaued at this relatively high level. This level is what we were seeing at the peak of our cases in March, as well as it is higher than what we saw in our little pseudo spike in July. So we have to be very careful. I've said this before, we are not out of the woods yet, and we still have to continue all of our mitigation strategies, including masking and distancing and isolation and quarantine when we're exposed, and all of those things to try and prevent this from skyrocketing out of control again. Next slide. Again, our case positivity testing. If you'll notice, our testing is heads down, and we want to keep our testing up because we will be much more ahead of this as far as knowing what's going on and identifying individuals early so they don't spread the virus unknowingly. And we need to keep testing. So please, if you have exposures or if you feel ill, even mildly ill, we urge you to go to our website. Our testing is free. It's located in Marysville. We take appointments to do that. And of course, our other community partners are still testing as well, like Care Medical and MedExpress and several others. And then finally, I want to speak briefly about our vaccine endeavors. You can see that we have vaccinated over 29,000 people, and that's over 14% of the total population, and that is 33% of our 65 and older. Now, of note, when we look at our pre-registration system, the sign up, and we've talked about how the majority of people have signed up in the first day or two of that system. We have gone through about 75% of the people that have been signed up. But when you actually look at those numbers closely, those who have signed up on the health department's pre-registration system only represent about a third of the people that are 65 and older, which means we're missing people, and we want you older people, 65 and older, to please seek a vaccine, either through us or through one of the pharmacies or through one of the hospitals. So we want to keep pushing that. St. Clair County is behind when it comes to vaccinating 65 and older, and I think there's some reasons for that, but we don't want to be behind. We want to get you guys vaccinated, and we're going to talk more about the increased eligibility. But as you may have heard, this coming Monday, the eligibility is going to be expanded to 50 years and older, particularly those who have underlying medical conditions and the caregivers of people who are taking care of children with disabilities. So we are going to be expanding that, and I just urge you, to way you get that vaccine, if you're in the expanded eligibility group, is to go on our website, scchealth.co, and register and sign up and put your information in there. And then when we get starting to schedule these clinics, we pull those names off based on the eligibility group. So that's how you get in. And then, of course, our dashboard, there's a number of really great dashboards. This is ours with our up-to-date St. Clair County data, but we also have some of the state dashboards that are following vaccination rates and all of the other issues that people are interested in. Let's get to our questions, and let's start a few questions with Mr. Watkins. Jen, do you want to ask him some of the questions that we received
Sure.
over the
Sure.
week?
Hi, Mr. Watkins.
Hey,
Let's start off with talking about your forum that you did last weekend with Dr. Mercatante and others at the Faith Christian Church, the self-care and vaccines. We'll start off with there because some of the questions that I'm going to ask you relate to some of those comments that were mentioned on that Facebook Live. So let's hear a little bit about that forum that you did, that show.
yeah, that was an interesting forum put on by Faith Christian, pastored by the pastor there's Pastor Trey Smith. And it was Dr. Mercatante and I were guests there. It was an informational forum. You had a lot of people there that were anti-vaxxers. You had those that were in between, and then there was theirs who believed in vaccines. So it was an interesting conversation. I believe we brought a lot to the table. And the people were asking questions, common questions. We had a good Q&A in regards to the vaccines. Why? We got a range of questions, especially for those who were totally against vaccines. And we talked about history of vaccines. We talked about the effectiveness and what they are, what's today, and how it relates to the coronavirus, COVID-19. So it was an excellent forum. I believe that there was a lot of Q&A after the forum was over. I mean, there's a lot of questions that we couldn't even get to. And I really believe, and I've been receiving calls since then from people that were at the forum. They got my number and stated that they would appreciate us being there and that they were convinced by us with the information we're giving them, because they were on the fence, that they actually come on over to the side of the fence to take the vaccine. So I was very encouraged by that, and I was hoping that we put the word out that we were more than happy to do more forums like that, because it's all about information. It's all about the knowledge, and as far as knowing the information so that you can make an informed decision. To me, I think no one's half the battle. You give people the information, they're intelligent enough, they can make the decision for themselves. Because I always encourage people. I tell my students this, I tell my patients that this, is that you are the ambassador of your own health. So you need to ask the questions, get the information, and then you make an informed decision on which direction you want to go. All we can as healthcare providers do is give you the information, and then you make the decision.
Great, thank you. So I'm going to reflect on some of the questions that I thought would be good to share in our forum too, that other people might be thinking about. So what are some of the most common concerns you hear from the Black and Brown community as far as the vaccine, the COVID vaccine?
Well, the main concern, a lot of people, we talk about the history of using vaccines and testing on the Black and Brown population. People always go back to that. The Tuskegee Project from years ago was unfortunate. And those kind of things hurt us. People see that was a reality. But the question they have mostly is what's in the vaccine? What are they hiding? Are people concerned about how this vaccine was produced so fast? That it must be, and then why, because of that, they want to use it in the Black and Brown community first to test to see if it's going to be harmful. And those are all misnomers. Those are all falsehoods that we try to talk through and give people the public reasons and explanation why that is not true. But most of what I found, people were asking questions about what's in the vaccine. What are we hiding that's in the vaccine? So we tried to address that issue the best we could.
Thank you. Another question was, what proof does the common man have that this pandemic is even real?
Well, that question was asked, and what I said, I give the same answer, is that I threw it back at them. What can you show or tell me that it's not a pandemic? What I can tell you is that there's 500,000 people that are no more, that are dead because of this coronavirus, COVID-19. That's considered a pandemic. They based on this not an outbreak. This is a community outbreak. This is a level of a pandemic by the number of people that are died because of that, directly and indirectly. So that's pretty much what I was stating. It's real. People was saying all the time they want to compare this to the flu. I said, okay, I would go with that. It's a flu, but it's a killer flu. You compare 30,000 a year dead to since January we have 500,000 plus dead. That speaks for itself. That's a pandemic. and that it stretches worldwide, not just locally.
Okay, thank you. Another question was, who decides what information is valid concerning our health?
Well, I say basically you, the person. Look in the mirror. You are the person who considers what's valid, and what you should take from that is that you go to the people that have the information. Go to the professionals. I tell them years ago there wasn't a question. You go back to Marcus Welby, MD, and basically that the doctor was almost like right under God. Is that the doctor said it was true? It was true. People believe it's the trust. But I tell people now that we only have blind trust in God. Everyone else needs data. I said, so you go to the people, the healthcare professionals that have data. We have data. And it's a consensus of research of the common professionals that come together with a consensus of what the data states and the reality of the data. So we speaking like at the forum, we were speaking from data. Dr. Mercatante gave much data. I gave some history and the present data in regards to diseases in general and this COVID-19. So I express to people, do your research. Go research yourself, and then ask those professionals, and then so you can make an informed decision. But make sure you go into credible sources to get the information. On the side, I always laugh with my family. I just mentioned this, and I kind of age myself. And people may remember, if you remember the great sitcom or the great series of Bewitched with Elizabeth Montgomery, and you remember the Dr. Bombay. I always tell people to watch out for Dr. Bombay. We know who he was. He was a quack and had postings and all kind of crazy things to cure people. Well, you got to be careful listening to people that giving you conspiracy theories like Dr. Bombay that has no footage in footing in sense and in research that data that we have formulated over the years to prove what we're talking about.
Great, thank you for bringing that up.
Dr.
Okay.
Bombay.
I remember that show.
I do too. I love that show. Me too.
Okay. And lastly, Kevin, what can the health department and other local partners do to help build the trust so the Black and brown populations feel more comfortable getting the COVID vaccine or other vaccines?
I would just say just giving the information, being open, being honest, answer the questions, respecting those that have a different point of view. And then if they're saying something like we do as health professionals, someone comes to us and have totally off information, they're totally wrong. Not only tell them that that's incorrect, but explain to them why that's incorrect. And take the patience and give the information, and people will respect that. And as you gain the respect, they would develop that trust. So being available for forums like Dr. Mercatante and I went to this past week is a step towards that. And I believe we gained a great deal of respect at that forum.
That's wonderful. Doc, do you want to add anything before we move on to the other questions?
I'll just mirror what Mr. Watkins said. It's important to listen. It's important to listen to what people have concerns about. And there's a lot of information out there, and a lot of it's wrong. But people have strong feelings about the things they've heard and the things they believe in. And I think it's important to listen and give people the time they need to process it. The only problem we have with that is that we have a killer virus on our hands, and we keep trying to keep this contained so that our world doesn't go upside down again. And so there is a crunch with time. It's important that people think about this now and not put it aside and say, I'll think about it later. They really do need to think about these things now.
All right. So I'm going to move into the questions. We had a lot come in last night, and then some reflect the ones today. And Kevin, if there's anything you want to add to some of the responses, feel free. Okay, we'll start with this one. How long do you foresee the need to quarantine if you were exposed going to be required in St. Clair County schools? What is the data point that will change the need to have a child quarantined for 10 days?
Well, we use isolation and quarantine to control almost all infectious diseases. If you have a different infectious disease, we use that disease pathology, the incubation period, how long it takes to get sick, all these things to determine how long to isolate and quarantine an individual so that they don't spread it to the other people in this congregate setting, whether it be at a school or whether it be in a nursing home or whatever. So isolation and quarantine is not going to go away. It will hopefully become much less common as we continue to control and vaccinate against this virus. But we always use that tool to control for outbreaks. We use it for measles, we use it for chickenpox, we use it for really any infectious disease outbreak, unless we have a specific treatment for it that we can give after exposure. And there are some conditions where if you have an exposure, we can treat everybody instead. So TB, for example, okay? But the idea that isolation and quarantine is just going to disappear, just take that off your plate. That's really not how we're going to approach this, unless we can come up with some amazing drug that we can give everybody every time there's been an exposure. And antivirals are generally not available like that.
So just to reiterate, for school-age children, it's not going to change either, correct?
For any individual, okay? The
Right.
virus transmits from person to person. And if you are sick and you have potentially exposed other people, the only way to prevent this escalation of cases is to draw a circle around all the people who may have been exposed and then ultimately get infected themselves so they don't infect other people, and it's this domino effect. So that is something we do for all ages based on their exposure history. That's just a tool. So it's not something we focus on just in school age. It's something we would do for any individual who's been exposed.
Some people,
Okay.
we chime in, some people seem to forget that we've been doing this for years. And they're focusing in on how this is affecting them now personally. They understand this is commonplace. That is called containment. We have to contain the disease. You contain it and you deal with it. Because once it spreads and got out of control, that's when the massive problems occur. So when you contain now, it's almost like temporary pain for long-term relief. Let's contain it now when it's local with those few kids. This team has to quarantine. Otherwise, before they infect, every team in the district. So
Correct.
It's important people understand that and not have a selfish approach to it. Always thinking in the bigger picture of things.
Back in the day when we had contagious diseases fairly commonly, cholera epidemics and smallpox epidemics and yellow fever epidemics, they would wipe out communities. And isolation and quarantine were a solid tool that was used even before we understood viruses and germs. So this is not new, and it is not a tool that's going to go away anytime soon.
Okay. Next question. Wouldn't it make sense to have an entire household, all the occupants in that entire household, vaccinated rather than just focusing on groups? Example, husband and wife whose husband's elderly parents live with them. Mom and dad get vaccinated, but their son and daughter-in-law who work outside the home aren't vaccinated yet.
Well, yeah, that makes sense, and that obviously would be a goal. But when you have limited vaccine, you can't just vaccinate everybody because we don't have enough vaccine. So we prioritize, we try and focus on groups that will have the most impact, the most bang for your buck, if you will. And remember, we still don't have vaccine for children. So we do have to still strategize this until we can reach that ideal situation where the entire pod is protected.
Okay, let me chime in that too. Recent news, listening to President Biden, is that his goal is, especially with the collaboration with J&J and Merck, and that's awesome, that the plan is that we will have enough vaccine in this country for every citizen by the end of May. They also speculating that by the end of March, every school teacher and those that are involved, bus drivers, janitors, anyone with pre-K and K-12 should be vaccinated by the end of March. So with that said, we can get people vaccinated. First, we got to get people to want to be vaccinated. That's a concern because right now it's not mandatory. And if you have, like I know some of the long-term care facilities have only a 40% or less percentage of the staff that are vaccinating. So the key is that if people, it's going to be available, like the president stated. Now we need people to accept the vaccine and take it so we can get that level of herd immunity, and then we will see a great change of course in this disease.
Yeah. We have in fact offered to every one of our teachers, K through 12 and preschool teachers, all have the opportunity to be vaccinated at this point. They always have been, and we have the capacity to vaccinate all of them. I can tell you that we have some pockets of schools that have less than 30% vaccination that are willing to get it. So even when the vaccine, as Mr. Watkins said, is available, we're still going to have some challenges of convincing people to do it.
All right. This next person is really happy that more people will be eligible to receive the vaccine this month. But how confident are you that St. Clair County will be able to accommodate all those 50 years up, 50 and older? And when will the county begin booking appointments for this group? Do we know that?
We are booking as soon as we receive vaccine, we book, as you know. And this week, we received more vaccine than we have previously, and we booked all the appointments we could. So we're very confident we can distribute all the vaccine we receive. And we're very confident that over time, everyone who wants a vaccine will get it. And as we just talked about, the bigger concern at this time is people not stepping up to the plate and getting vaccinated. And we're going to have big pockets of vulnerable people that are still going to spread the germ. So yeah, we're confident we can do it, and we're confident we're eventually going to get the vaccine we need to do it.
And will there be any type of documentation needed to show that you have a pre-existing condition?
No, we can't do that. I think that's an unreasonable barrier to say you need a doctor's note or some kind of prescription bottle. No, and so really we're just asking people for the first, starting this coming Monday until the 22nd, for the first 2 weeks, that we focus on individuals 50 and older who do have medical conditions. And of course, in our sign up, there is a drop-down box for medical conditions, and we'll be pulling from that. But quite honestly, we're going to take people at their word. If they're in the right age group and they have a history of any of the medical, and the medical conditions, honestly, are quite extensive. I would say at least 50% of the population has one of these conditions, if not more. So that it even includes an elevated BMI, right? Being overweight. So I really think the goal is here to just start vaccinating 50 and older. We're going to try and prioritize those who have underlying medical conditions first, but we're just going to start moving and getting them done.
Okay.
I would add to that, and I was teasing with some people the other day who asked me that question. I said, the bottom line is, if you're over 50, you probably fit in one of those brackets. But the bottom line, we all have a predisposed situation in regards to walking around people that refuse to wear masks and refuse to follow the guidelines of the CDC. That predisposes us more so to being infected.
Yeah.
Interesting point. Yeah. Okay. The next question was, if a business has employees testing positive for COVID-19, do all the cases need to be reported to the health department? And who would do the reporting, the business or the employee?
It can be either. But obviously, we like it when the businesses report, because then we can work with them to make sure their policies, their quarantine practices, all of those things are done properly. There's a lot of confusion out there. How many days? When does it start? When does it end? And we understand that. When we want to help you with that. So we want to make sure that people report, not so much because we want to know, it's because we want to help you draw that circle like we talked about, so that you don't have this domino effect of sick people in your workplace. So either one can report, but we really do like it when the employers report, so we can work on them with their policies, on their workplace policies.
Okay. The next question was, I was told that we should avoid contact with folks for 2 weeks after the second vaccine, as we are shedding the virus. I was going to volunteer at the COVID clinics, but was told I should wait so I don't possibly expose anyone. Can you clear up that, please?
Yeah, that's not true. You don't shed this virus because there is no virus in this vaccine. There's no way to get COVID from these vaccines, and there's no way to shed the virus. So there's absolutely no reason not to go out after you've been vaccinated. We obviously, if you feel poorly, we want you to stay home and potentially get tested. This vaccine can make you feel a little ucky for about 24 hours. So we don't expect you to rush out and do that. But this vaccine will not cause any kind of viral shedding. You don't get COVID from it. It's not capable of causing an infection with COVID.
Speaking of when you said that people might feel yucky, for example, this next person had asked, what if you get a reaction such as sore arm, feeling like you have the flu-like symptoms, headaches? What's the typical time it lasts for? And do you need to call your doctor or just write it out?
That's a good question. And I would say 50% or more, we're seeing getting some kind of a local reaction or some body aches and low-grade fevers. And they can last anywhere from 24 to 48 hours, although the majority, I'd say, are gone within 24 hours. And why do some people get them and others don't? I don't think we have that information to really tell you. It just seems to be a phenomenon of different people's ways their immune system responds to antigen exposure. So when to call your doctor? You want to call your doctor if you're having difficulty breathing, if you're having mental status changes, so if you're confused, you're disoriented, really all of the things that you would consider calling your doctor for. If you have underlying chronic medical problems and are really suffering, give them a call and see what they say. The vast majority of all you need is just some rest and some fluids and to wait it out. But if you're concerned or scared, go ahead and give them a call.
Let me chime a little bit on there. That's usually a good sign if you have some type of some of those symptoms. That means your immune system is alive and kicking and is being activated to prepare if it's exposed to that coronavirus to fight it. And it's kind of interesting. I took the shot and I was fine course. It felt like someone socked me in the arm 24 hours later. But the key thing was so funny is that I was having instead of like a hot flashes. And I told my wife, I said, my God, this is what it's like. I was turning the thermometer down. She was freezing. I'm so hot. And she said, "Oh my God, I know why you do that. I'm never going to get mad again because I was on fire for about 12 hours."
I'm glad you could relate. That's good. Okay. All right. Next question. How long are the vaccines effective? Are they like the flu vaccines, and is it good for a year? I've heard that maybe boosters will be needed. Is that true?
Yeah, that's a common question. And the most honest answer I give you is we don't know. We don't know. I think some of the clinical trials are now getting into the 9, 10, 11-month mark. And the immune response remains robust for some of the vaccines at that mark, but some of the clinical trials are barely 6 months old. So you're going to have to just watch the media and the literature and find out. Now, boosters may be needed, especially if we have variants that outsmart the protein exposure that we're using for the antigen. But we just don't know. We just don't know, and there's a lot of really smart people that are working really hard keeping on top of this issue.
All right. Next question. How long do you think it will be before my developmentally disabled young adult child can be immunized? She's a student at Woodlands and has been out of school since last March.
Well, the Pfizer was approved 16 and older, and the other vaccines are 18 and older. So I would think that individual is going to be eligible as soon as we expand beyond this 50-year-old mark. And did the state? Yeah, they did release a new timeline. Who gave that to me? I apologize. I don't have it now. May? I'm guessing. But, with Dr. Biden's, President Biden's remarks about trying to get enough vaccine out by May, the eligibility is just really based on the availability of the vaccine,
right?
So we can be strategic in getting the groups that are most vulnerable. And older people are most vulnerable. But I agree. A vulnerable young adult with disabilities should be on the list. And I found that list. And I would say 16 to 49 with disabilities, pre-existing conditions, and they have the end of April. But that's an estimate, and things can get pushed up pretty quickly, especially if that vaccine starts rolling in. So just stay tuned.
All right, next question. Is there any contraindication for taking things like ibuprofen or naproxen for side effects? I'm thinking unwanted immunity suppression.
Yeah, you're correct. We don't know. And the advice is if you don't have to take antipyretics, anti-inflammatories after vaccine, not to do it because it may reduce your immune response. That's just hasn't been studied effectively with these vaccines. The exception to that, however, is if you are pregnant and receive a vaccine and you have a fever, they do want you to take acetaminophen or Tylenol because fevers in pregnancy have been shown to have adverse outcomes, and that outweighs the potential risk of suppressing the immune. So again, it's a risk benefit game all the time here. But for the general public, we would encourage you not to. But I tell you, if you're absolutely miserable and you can't get off the couch and you can't get yourself a glass of water, you might have to do something. So some of this is just kind of common sense.
All right. And then the final question that came in last night was, are there any ongoing studies or known information on future fertility for young women with parenthood in their future?
Well, yes, there is. There are ongoing studies in women of childbearing age, as well as ongoing studies specifically for women in pregnancy. And we're going to see some of that data, I think, coming out soon. But the issue that this vaccine can somehow interfere with fertility is, quite honestly, it's a myth. It's a myth that was propagated by some distortion of information, which is there are a few amino acids, proteins in the placenta that are kind of similar to the coronavirus spike protein, and that somehow this similarity could cause a theoretical attack on the placenta. And number one, it just doesn't, that's not true. The similarities are not similar enough to really create that. It's theoretical at best, and there is absolutely no historical precedence to this. In other words, there are no vaccines that have ever impacted fertility of a woman or even pregnancy outcomes. So quite honestly, I think that's a myth that's been propagated, and that's a scary thing for a woman of childbearing years. And I would take that off your plate, because I really don't think that's one of the concerns that you really need to have on the top of your list. I would be more concerned about getting COVID, particularly if you're pregnant. COVID infections have been clearly associated with poor outcomes in pregnant women. And just because we talk about older people having more bad outcomes with COVID, there are plenty of younger people who've been hospitalized and have died from COVID. So please remember that just because you're young and healthy doesn't make you like Superman, that you don't have to worry about it.
Yes, and also adding to that, we don't still know. We're still doing research and don't know what the long-term effects are going to be if you have COVID.
Of a COVID infection.
If you have COVID as a young person, and then you survive it, but what are the long-term effects are going to have on you when you decide to become pregnant? I would be more concerned about that than the vaccine being a problem.
All right. The next question is, these are off the live feed now. Justin, how long does the vaccine last? You covered that already from last night. The next question was, can we get current vaccinated numbers versus the numbers of people registered? Not sure what happened.
Well, that's Dr. Mercatante. That's pretty much her.
Yeah.
Arena.
Okay. She must be. Russ, can you hear me?
I can, and I think a lot of these questions, you know the answers as well as Doc, unless they are specifically medically related. So if you want to answer them, I think that would be fine.
Okay. I just was wondering what happened to her screen. We're sorry for the technical difficulties. One of the questions that came in was, how many vaccine doses do you expect to get next week? I believe Dr. Mercatante mentioned that already. I believe we average around 1,000 up to 1,200, though that could change, dependent on the supply that comes in. Sometimes we get more than like expected, such as what happened later this week. Okay. This next person, I'm just going to summarize. His mom is 89 years old, and she still hasn't got her vaccine, but she signed up he signed her up as well as himself. He's 64. They live at Peru Senior Village, and they don't know what to do. They want to make sure that his mom gets the vaccination. So,
where is that located? Is that in Port Huron?
That's over. Yeah, that's part of the Port Huron Housing Commission, Peru Village. It's over there by SC4. And I think he's been struggling with wanting to get his mom and himself vaccinated.
Well, we have a clinic.
Okay.
Go ahead, Dr. Mercatante.
Oh yeah. So I apologize for getting bumped off. But number one, if you've signed up and receive an invitation for a vaccine, we want you to take it. But Mr. Watkins and I and several of the community leaders are setting up a couple of vaccine clinics for next Friday and Saturday here in the South Side, close to the health department. And we are looking for individuals that have been unable to get out to the Blue Water Convention Center and some of these larger vaccine clinics and try and assist them getting vaccinated closer to home. So if you know Mr. Watkins or one of your local pastors, you can reach out to them. Reach out to me at COVID-19@stclaircounty.org. And we'll make sure you get an appointment. And then for all of you listeners, if you've signed up and you think you've been overlooked, send us an email and we'll just make sure that we get these links sent out to everybody more than once. These electronic systems aren't perfect, but we don't want to forget you, and you just need to just kind of knock on our door. We're asking if you don't have to call us, don't. Because our phones can't accommodate more than a million calls a day. But send us an email at the COVID-19 or contact one of your local pastors, and we can try and get you in.
And let me add to that and help you out. Please branch NAACP at Port Huron NAACP@gmail.com. You contact us with the email, leave a message, and we'll make sure that you get signed up for this for the clinic we're going to have on March 12th and March 13th.
Right. Thank you. All right. Can we get current vaccinated numbers versus the numbers of people registered?
Yeah, I thought I just gave that. Do you have that? I'm sorry, I don't have it. Oh, here it is. So for the total number of vaccines, so this is St. Clair County residents who are vaccinated, thank you, 29,241. Those are the actual vaccines that are entered into the MICR system, so they have been administered. And that is, as we mentioned, 14% of the total population and 33% of the 65 and older. Huh?
Okay, thank you. Go ahead.
What?
People registered.
70. So for out of our system, the Everbridge system that we set up for pre-registration, if you will, our waiting list, we have gone through 77% of those individuals. Over 65. What do we have total? Do we know? Of course, we've only been vaccinating 65 and older, so that's probably the only fair thing to say. And as we get into the 50 and older, we'll get to some of the rest.
All right. The next person wonders, is there an age group that seems to be the cause of most of the COVID cases?
It's all over. It's across the board. The infection rates are across the board. There's no one exempt from getting infected and spreading it. The people who end up in the hospital most are the older individuals.
Okay. How many vaccine doses do you expect to get next week? I said when you were cut off there, Doc, normally we get 1,000 to 1,200 on a good week. Is that correct?
That's what we've been told to expect. We got a little bit more last week, I think, because honestly, they looked at our numbers and realized we had under-vaccinated. We were under-vaccinating our 65 and older. They gave us, I think, another, 800 doses? Something like that. So I would anticipate between 1,000 and 2,000 doses. That's probably fair to say that's about the range we're going to get.
Somebody wants to know when we are going to start calling the new eligibility group that opens up this coming Monday.
As soon as we know how much vaccine we're going to get and how many appointments we can schedule, those appointment invitations will go out. So that's usually Friday Friday through the following Wednesday. I mean, each day, if we don't have the clinic filled, we'll keep sending out invitations. But I would say expect it no sooner than Friday.
And somebody asked, can a 43-year-old person register right now, even though they're not up for the age group? And the answer is
Absolutely.
yes, anyone can.
Yeah, absolutely. Please, and please do, because that gives us an idea of what we've got to work on.
And keep in mind, there's definitely light at the end of the tunnel. We're in March, and we've been promised that we will have enough vaccine by the end of May. And keeping the numbers and the people that can get them based on the age groups is based on the amount of vaccine that's available, like Dr. Mercatante mentioned. So we're talking about having enough for every American by the end of May. Then that speaks for itself.
Okay. This next person asked, if on Monday the new authorized group expands, will people 65 and over who newly registered be placed ahead of those currently on the list?
That's a great question. I think we have to talk about that. My instinct is, yeah, we should, to try and finish you guys up and get you done. Can we do that? Can we pull 65 and older first? And then, so yeah, I think we should do that. I think we should make sure our 65 and older all get invitations first. I think we're going to have enough vaccine to do everybody that's left on our list for 65 and older, in addition to the 50 and older. I'm pretty confident that we're going to get there very quickly, if not next week, the following week. But thank you for that question, and we'll have a internal conversation about how to get that done.
Okay. One of the other questions was from the gentleman who also asked about him and his mom. He wondered why white people are first in St. Clair County to get vaccinated.
Well, I'm going to start, and then I'm going to let Mr. Watkins finish this, because that isn't the intention. We certainly don't go through when we send out appointments and identify who's white and black. But I think this is a direct result of what we call social determinants of health, that white people have better access to computers. They have better access to transportation. Their communication system, they're quicker to find out about things. And it certainly was not our intention, but it's why we feel it's important to have dedicated vaccine opportunities for the Black and brown community, so that we can compensate for that unintentional event. And this is just kind of you look at the system, and why does that happen? Well, it's a whole structure of how things are set up. And I don't know, Kevin, can you add to that at all?
Well, yes. What I just want to say is that you just answered the why. Perfect. I can't really add anything to that. So now I'm going to answer the how, what we're going to do about it. In regards to that, is that to bring people so they have access to the vaccine. That's why we're having this clinic on the south side of Port Huron at the Harvard Reinvestment Center on March 12th and March 13th, to be in the neighborhoods of a lot of those who are not able to have access to it. And then we also going to extend there, if they don't have transportation, go get them, bring them to the vaccine. We're going to utilize the NAACP. We're going to utilize Sons, Save Our Neighborhoods and Streets. We're going to utilize a SCORE, their van, and we're working with the Port Huron transportation system to help us get people there so we can remove that barrier. So you're absolutely right that it seems that way because of what Dr. Mercatante just mentioned. So now the thing is the game plan, action plan to remove those barriers, to bring people to the vaccine or make it closer to them so they can get there and remove those barriers so that we can close that gap.
Now, I'll just want to kind of mention to clarify. So these clinics are intended for people that live in these communities that we will be targeting directly. So for the rest of you listening, for the rest of the St. Clair County world, we will continue to be holding our normal clinics at the Blue Water Community Center and down in Marine City. And hopefully maybe we can get something out. We still haven't really targeted that west side of the county. So those opportunities are going to continue as well. So for these dedicated communities to the south side, we want you to know that those clinics are set aside special for you, that we're trying to reach out to you directly. But that doesn't mean that all the rest of you can't continue to get vaccinated as well.
All right, this next person just kind of had a comment, so I didn't know if you wanted to comment on it, but unless you're over 70 with health issues, your immune system is better at fighting this than the vaccine. Remember, it's only 95% effective. And then he went on to talk about the survival rates in each age group. Do you have anything to add to that? Can you see that up there on the screen?
Yeah, that's not true. I'm not sure where you're getting that information. Certainly, the bulk of information that we have suggests that vaccine is in fact effective for elder. In fact, the clinical trials were done specifically to include older individuals. The vaccine's not going to kill you, where the natural virus has a better chance. So yeah, you're going to take your chances with the natural infection, certainly. And the vaccine will be effective for you over the age of any age, actually. There's no limit to the age that it would be effective. And although older, okay, but I just want to say there is evidence to suggest that the older you get, the less effective your immune system is in general, which is probably part of the reason why some vaccines don't work particularly well in older people, but this one does. And we have to say that we feel that this is still a better choice than risking the natural infection.
And let me just add to that. I keep going back to this. I think some people laugh because I keep going back to this. But people got to remember, go down memory lane. Do you remember mumps? Do you remember measles? Do you remember whooping cough? Do you remember polio? Those were things that vaccines have wiped out. It was the vaccines that saved millions of lives, that if they were still getting polio, mumps, measles, rubella, whooping cough, with our children, we would still have children dropping like flies, dying at very young ages because of these diseases, but they're no more because of vaccines. So you think about that. This is a novel virus, and we hopefully with these vaccines, we're going to wipe it out also. And it was not going to end here. We're going to have other issues, contagions. And then as we develop more vaccines, and because we have the technology, we can create these vaccines at warp speed, and then we can combat these viruses and continue on living.
Yeah, right. I thank you. I just, I'm going to just say, people have forgotten, Kevin, what it was like, because we studied it in nursing school and medical school, what it was like when entire communities had to deal with these widespread infectious diseases. It's only been in the last 100 years that we've had a tool that was effective to really control these. And I just say, why in the world would you not want to use the advances of modern medicine and science to deal with a horrible infection that can kill you? Why would we do that? Why would we want to do that? I would agree. And I think because we've kind of forgotten how horrible it is to be sick, right? I mean, and to have large amounts of people get sick. And this is what we experienced in our hospitals very recently, where hospitals were filled to the gill. And if you went in with something else, you had a good chance of being discharged because they didn't have the room for you. So I think people need to really kind of do their homework and look at history and think about what our grandparents had to deal with before vaccines occurred. Thank you for reminding us.
Absolutely.
Okay. The next question is, I have systemic mast cell disease. Can I take my medications prior to the vaccine to control a reaction? Is there any medications they recommend not to take prior to?
They're actually suggesting that you don't take antihistamines prior because they're concerned that may interfere. But there's not been a lot of studies about what medicines you should or shouldn't take. And we get questions every day from people who take various meds, methotrexate, immune suppressant drugs. We just don't really know what we generally tell people is it's safe to take them. But what we don't know is how effective your immune response will be. It may alter your immune response. So if you need to take a medication, it is not a contraindication to getting vaccinated. We're just not 100% sure how robust your immune system response will be. And I'll just say, better something than nothing. And in situations like this, you go ahead and get vaccinated And with any luck, in time, we're going to have post-vaccination serology, where we'll be able to check people for their immune responses, and we're going to have more tools to help identify who needs a booster and who needs more help. But for now, you're going to get something. It just may not be as good as somebody who doesn't take those meds.
And don't forget the importance of those who do have a personal care provider, physician, or nurse practitioner. That you check with them. They're the professionals who can answer these questions for you and can calm you on those reasoning.
Exactly. Okay, this person says they're experiencing extreme fatigue and weakness 4 days after their second vaccine. Should they be concerned?
Again, it depends whether or not things are getting worse. Just because it happened timing wise after the vaccine, don't forget that some things can happen. Yes, there have been deaths following vaccine, but those deaths are not tied, they're not caused by the vaccine. When you give 70 million vaccines, there's going to be things that happen afterwards timing wise. So timing isn't the same thing as causation. So if you're having a problem after the vaccine and it's not resolving spontaneously, it's getting worse, please contact your doctor for further evaluation. It may be from the vaccine. You may be one of those unfortunate people that's going to have a week of this. The average time is 2 days or less, but it doesn't mean that people don't have longer side effects. But also don't forget that other things could be happening to you that are unrelated to the vaccine. And that's important to check out.
We had a repeat question, but they maybe joined us late. When are you going to start scheduling the 50 and over with medical conditions? And we talked about that already, as far as anyone can get on our system or another system and pre-register. But they wondered about, is cancer considered part of that group?
Yes, cancer is a medical condition that increases your risk.
Okay. I'm not sure how to pronounce this. So Russ, if you could put this on the screen, the polysythemia, vera, age 38.
Polycythemia vera. It's a medical condition.
When can he get the vaccine?
So the state has kind of come in and said, we're going to use age as a criteria for now. This is based on the amount of vaccine they believe they're going to get and be able to distribute. So unfortunately, regardless of your medical condition, if you're under the age of 50, you're going to have to continue to wait. Now, you'll probably be in front of the line before a healthy 38-year-old, okay? But you're probably still going to have to wait probably about that date we talked about with the other individual, April-ish, about a month, maybe more, April or May. I hope sooner, but that's probably about when we're going to start seeing that open up.
All right. The next person said that they received a Humira injection for Crohn's, and then they're scheduled for their COVID vaccine. Is it a problem if those things are done closely together?
We don't know.
Okay.
We don't know. Talk to your doctors. Some doctors are advising waiting a week to get the vaccine, or maybe waiting a couple, if you can, maybe getting the vaccine and waiting a week or two afterwards. But we really just don't have a lot of information. Again, it won't hurt you. Your medicine will still work. The problem is whether or not the vaccine will work as well as in someone who didn't receive that.
All right. The next question is, when will restaurant workers be able to get the vaccine? Do we know that?
Oh boy, and I know you guys are a really important group, and we have a lot of discussions about how important it is. We all love going to restaurants, and we'd like to see you guys vaccinated as quickly as possible. You may be in the 16 and older healthy group, the one we talked about in May, or maybe they'll move you up and put you into the food and agricultural worker category. But right now, you're not in an eligibility group unless your age is 50 and older. That will start on Monday.
The next person asked, why can't you manage as well as Sanilac here on Oakland County's higher percentages of people are vaccinated there?
Is that true? I don't think that's true. Well, is that true?
They've received a larger portion of vaccine.
Oh, okay. So what my informatics guy is saying is they received a little bit larger proportion of vaccine per their population. I can tell you the other thing that's happened in Sanilac County is they have a strong partnership with their hospitals, and hospitals are also receiving vaccine, and they have collaborated closely to do some of that. Our hospital systems are not. And so they're doing their thing, and we're trying to do our thing. And I'm trying not to compare ourselves too much, but I have to say, I think our staff is working very hard as much as we can, and we're getting every dose of vaccine out into people's arms very quickly within 7 days. So that's the best we can do.
All right, and that wraps up our questions, and it's almost 4:25. So why don't we do closing comments?
Well, I just want a special thanks to Kevin Watkins and really all the people that I've been working with to try and make sure that this vaccine is provided in an equitable way and make sure we get it into our more vulnerable population. So Jerry Johnson and Pastor Kim Brown and Kevin Toddy and Jessica Toddy, all of you, I apologize if I forgot your name, but we really are working really nicely with our community partners. And all the rest of you who are out there listening, thank you for listening, for being patient, doing your best to spread the word. So if you've received a vaccine and believe in vaccine, support vaccine. There's a lot of people who are on the fence. They're not really sure. And they listen to people that they trust. And just saying something like, I got my vaccine and, I feel better. I feel safer. I feel more confident hugging my grandchildren, whatever the situation is, gives people hope and it gives people courage. And that's really what we need to do. We need to hold each other up. We need to hold each other up during this difficult time and not try and stir the flames of fear and concern. Let's work on this together, and I think we're going to do much better as a community.
That is awesome. And I would like to say I want to thank Dr. Mercatante, thank the Clair County Health Department, and all those who are working hard to increase and improve the health of our public. I look at Dr. Mercatante as my partner in education. This is what we do, and especially what nurses do. We educate. I believe in that formula of disease prevention plus health promotion equals wellness. Wellness for the community, better outcomes. And the nursing aspect, we have the health promotion aspect. And then part of that is education. So I'm an educator by what I do as a profession. And then I will share that. And part of that, I'm very passionate about this. That's why I go back to history with the vaccines and vaccination, what vaccines have done for us, what they're going to do for us here, now, and in the future. And I encourage you to speak out, to ask the questions, become comfortable, because I want you to take the vaccine, because I believe that's going to help save your life and save others. And I feel that in my heart. I feel that in what I know about science, about nursing, and about educating the community. So I just want to mention too, this is just the beginning. This vaccine clinic we're going to have on the south side of Port Huron, March 12th and March 13th. It's just the beginning of a series of other clinics we want to have. And the group that I co-chair, Clair County Diversity Initiative, when we have a say, the hashtag Better Together. We all are better together, working together to bring good health to our community. So please come, sign up, spread the word, spread the good news that vaccines are here. And we have these companies, Pfizer, Moderna, and Johnson & Johnson. Now Merck is leading the way to help bring us back to as much as the best we can to some normalcy. We can live our lives. And basically said is keep on living. I like life, and life likes me. It likes you. Let's continue living. Thank you.
Thank you.